So, obviously that's my talk, the creating successful rescue veterinary partnerships. It's really not, I was just sitting here talking to Patricia a second ago. The lecture's basically, be nice to one another, basically what it is. So, this is interesting because obviously this is a bunch of educators and HRS rescue individuals and not a lot of veterinarians, of course. Are there any veterinarians in here who are not speakers? Yeah, okay. That's what I would expect. So one of the things I wanted to, well, first of all, when Judith asked me to do this lecture, I thought, well, okay, I can do that. It's kind of a dry topic. All the rest of the veterinarians got these cool topics like geriatric rabbits and what to do with when the vet doesn't open. I get relationships with veterinarians. So this isn't a very long talk, so I want to make it a little interactive. If you guys don't mind asking if I ask you some questions. How many of you guys have good relationships with your veterinarians? Okay. How many of you would like to have better relationships with your veterinarians? Okay, good.
Will there be discounts?
What's that?
Will there be more discounts?
Yeah. Exactly. So does anyone mind if I call on you or just ask you, like, what are some of the topics? Because in these lectures, or when I go to meetings, as a matter of fact, I have another meeting to go to today and for the next 3 days on other veterinary medicine topics. And one of the things I always love is to talk to my colleagues and find out what they're doing and learn from them. I learn a little bit from the lectures, but I learn a lot from what they're doing. So would anybody mind raising their hand and let me know what challenges they have?
So I have a great relationship with one vet, Keith Bold, who you probably know from when you lived in Virginia. But the other vets in the area, they charge us a lot more money, and so we can't bring our rescue rabbits to them, and we drive a longer distance to see the one veterinarian, and we'd like, even if they couldn't give us a discount all the time, maybe we could get them to give us one free spay neuter a year, a month.
So I'm sure it's hard for you guys to hear that. They have a great relationship with one of their veterinarians. She's from Virginia, and the other veterinarians from Maryland. And other ones don't give them as good a discount. So that's obviously one of the common problems. How did you know I was from Virginia? Did they say that?
You worked with Scott Stahl.
I know I did. I just didn't know you. When I first graduated from school, I worked at Pender Veterinary Clinic in Virginia with Scott Stahl, and he taught me a lot, and he's a great guy. Anyone who knows him out there is amazing. Who else wouldn't mind commenting on any other challenges?
Sometimes we feel like most of the rabbit vets are also avian vets,
Right.
and that they really love the avian work more than the
So I don't know if you guys heard that. Most of the rabbit vets are also avian vets, and I like the avian vets work more than the bunny work. And that was actually true with Scott and I back in Virginia. He was a reptile guy, and he loved the reptiles, and I was an avian guy, and I loved the birds. What's that?
He's allergic to rabbits.
Yeah, he is allergic to rabbits. But we both came to love rabbits. As a matter of fact, I like my rabbit patients way better than I like my bird patients. Way better. They don't bite as much, and they're great. Anyone else want to volunteer?
One of the problems that I have in my community is that we're incredibly underserved with rabbit-savvy vets, but we have a very large population of rabbit households. And part of the problem is that our university, our teaching university, does not do anything with exotics. Zero.
Where are you from?
Minnesota. It's the University of Minnesota. And so one of the problems is how do we cultivate an interest in rabbits, and how do we get vets to be interested in serving the rabbit community?
Right, that's one of the things I was wondering about, because I think I live in my little bubble because I'm really into exotic animals, have been so, and now holistics, as the intro said, for years now, but I live in my little bubble, so it's one of the things that we need to work on is getting vets more educated. And that's an interaction between, and that's one of my points in my talk, is interaction between you as educators and veterinarians. I can't tell you how much I've learned from health rabbit educators, honestly. I don't know what I think I would be in the dark still about rabbit heart disease and liver torsion and adrenal disease if I didn't talk to Judith and Patricia and all these people. So I think you have to work with a veterinarian who's willing to learn, and that's a big deal too. But anybody else?
It may be a unique situation, but I have an amazing vet, and when I talk to people about what he does for our rescue and clinic and the things that I see, because I've witnessed surgeries, I've been there as he's doing things, and so like he'll walk through, he really wants you in the process of these exams, but taking an owner into that situation, you can't do that. So how do you get an owner who's not an educator, not part of a rescue? How do you get their rabbit the level of care it needs with a vet who wants the owner as hands-on as the rescue is? I didn't phrase that right, but that's one of the challenges I think we have is just the rescue can't always be the ones taking owned rabbits in,
Right.
but yet
Is it a cost issue, you mean? Or is it-
no, just to take an owner in to this vet and have them see some of the things that the vet's doing to care for the rabbit, it's overwhelming for them. To me, I'm like, this is awesome. You're doing such great things. You're taking such great care of this rabbit, but somebody who hasn't had that experience is overwhelming for them. So fostering that relationship, helping the vet to see it's okay to do that with an educator, with a rescue person, and not with this person who's new to the industry.
Right, that's maybe a little bit of a one-off. That's kind of a strange situation. I don't know. I would, but it's a long question. So why don't we do this? I think I kind of got. We'll take one more. Go ahead.
I'm in the DC metro area, so it hasn't been as much of a problem for people where I am, but I've noticed in other places, specialists, trying to get specialists like cardiologists and ophthalmologists who will deal with rabbits, they're like dog and cats, and that when you need a specialist, sometimes you got to bring a savvy traffic vet. But the one thing that we do have, I know in Indianapolis, is we have holistic vets who do agriculture like rabbits.
Right. Good. Very good.
That's a big problem.
Yeah, and that's a big problem for anyone who does exotics, not just for house rabbits or anything like that. I do, birds, of course, and reptiles, and getting a cardiologist to do an ultrasound on a heart on a rabbit I have one that I work with, and getting CT scans done, ear ablation surgeries done, it's always kind of challenging to find a veterinarian to step outside of their dog and cat box, if you will. So anyway, so I'm by no means an expert. Oh, there's one more that's persistent.
My basic question is, I know what the advantages to rescue of having a vet who gives discounts, what is the advantage of that?
All right, let's get into the talk. I didn't pay her either, actually, so that's going to be a good segue. So what I wanted to talk about, and I did some research on this because I thought pretty much as I was talking to Patricia, this is pretty commonsensical stuff, but I did some research and I found out that, quite honestly, I found out there's a lot of veterinarians who don't like working with rescues, and I didn't know that because I worked with House Rabbit Society, I've worked with Project Wildlife, Sky Hunters, a lot of other groups that I don't even get paid for at all, and I never even thought that it was an issue. I've also worked with, by the way, I've also worked with other rescues that didn't go so well either, and we can tell those stories too. So I've been working with the House Rabbit Society here for probably 17 years, I'm thinking, somewhere around there. I've been a vet for 21, so kind of been around a little bit. But why don't we, next slide please. So why do we want to work with you guys? Why do you want to work with us? What do we gain from this? If you don't mind, I'm going to grab my computer just so I can see it without turning my back on everybody. So that is the question. Why do we want to do this? I mean, I know why you guys want to do it, right? You want to do it maybe for discounts. Maybe, right? Possibly. Anyway, but there's something to be gained from both of us, actually. And so go ahead, give me the next slide, please. All right, good. Now I can see a little better. All right, so what is the rescue game? It's really not all about money. At least I hope it's not all about money. Of course, discounted free services. I honestly don't know what we give as far as a discount. It really is. I think it's somewhere around the neighborhood of 40 to 50% on most things. Is that pretty typical for you guys, or 20%? Okay, so that's a big deal. I know we give a lot, and the reason why is because the San Diego House Rabbit Society gives a lot back to us too. So you're clearly losing money on the transaction if you look at it just simply from well, I'll talk about that next. So one is you get discounted services. Two, hopefully you get advice of trained professionals, veterinarians who know what they're doing. That would be really good. We don't know everything. We don't always get it right, but hopefully we get some of it right. Hopefully you have increased access to veterinarians. That's a big thing, I think, in my mind. Over here in San Diego, they can either contact me on my cell phone, text me, email me, or call me at the office, which is the worst thing to do. But they have access to me. In other words, I could, and my doctor, so we'll text, very frequently at odd hours, even on the weekends. And that's, I think, a big benefit for you guys. I would hope so. Also, that if you get a veterinarian or a relationship with a veterinarian, you're going to have an advocate for the house rabbits. We're going to talk to people about, not keeping the rabbits in a hutch outdoors, which I don't see very much anymore, but I think we have a little, like I said, a bubble because we have a very interesting selected clients from the house rabbit. We don't get that outdoor bunny anymore, but I'm sure we still see quite a bit of those, I'm assuming, right? I hope not, but I bet we do. You're going to hopefully gain some increased knowledge on rabbit medicine. Just recently I was texting one of the house rabbit people about how to calculate drug dosages and what's the proper dose of Revolution to put on your rabbit. And so hopefully you will learn some medicine stuff and be able to treat your rabbits without bringing them to us. Because I don't know about you, but I hate going to the doctor. So I'm assuming you guys don't like bringing your rabbits to the doctors either. So you're going to also have a trusted partner, and one that you could, trust that we have your back and you have ours. And then referrals. I mean, obviously rabbits do pass away, and the next question always is, where do I get my next rabbit? Hopefully the answer is go to the House Rabbit Society. I never ever say go to the pet store. So, and I hope that's the same for most people. So that's what you gain. What do we gain? Next slide. So we gain a lot, actually. We don't, so there's definitely a morale boost. There's always that joke in veterinary medicine that every veterinarian technician has like a three-legged, one-eyed dog, because we do. I have a one-eyed dog. I've had two one-eyed dogs, actually. But it's true, and the reason why is because we have those animals that nobody wants. And we feel for those animals that nobody wants, because that's what we got into it for. If anybody got into veterinary medicine to make a living and make a huge windfall, they made a really bad decision. So, and I think everybody knows that now, but it's a really big staff morale boost. Everyone really likes working with animals who need homes. That's a big deal. There is some increased cash flow, so if done well, there's some, and trained in if the flow is good, it does help with revenue. We get some community involvement and support. So we get support from you. It's nice to give back to our local community, and it's also really good PR. So if you can imagine, if someone's going to put it on their Facebook page that they work with, Project Wildlife and Sky Hunters and this rescue and that rescue, and some general person might go, oh, I'll go to them because they seem like they care. So that helps a lot. And like I said before, increased experience and knowledge, because over the years, I've had a really tight working relationship with HRS, and Judith in particular has helped me out a lot to learn a lot about rabbits, and I feel very comfortable with that. And I feel very comfortable taking that information from people. Like if you tell me something, I'm like, oh, that's interesting, and I'll research it and see if it floats or not. But we learn a lot. Again, trusted partners and hopefully referrals. Hopefully you guys have that. Do you guys have that typically? Like if you do an adoption, they give 3 exams out? Is that typical? Yes? No? Yes? No? Oh, okay. Well, that's a thing that I don't know if that would help at all, because veterinarians thrive on referrals. That's how they keep going. I mean, animals die, right? So unfortunately, that we need to replace them. And one of the easiest ways to get new clients is referrals. And if you're able to get a veterinarian who will do free exams from your adoptions, that really helps them out. And so try to educate them on letting them know every client they got is worth a lot of money. I mean, usually they're worth a lot of money. So I can't remember what the exact number is exactly, but it's going to be worth probably $5,000 over the lifetime of that pet easy. So if they think about that as a dollars and cents thing, the free exam that might cost $50, $60, $70 or less or more is well paced for itself. So that would be one thing I would really try to get people to do on your side, is to at least discounted exams, free exams. Anyways, next slide. All right, successful relationships. So, like I said, this is maybe a little bit dry, but relationships obviously are, over there. They're not always easy, right? If they were easy, everyone would work out. There wouldn't be a 50% divorce rate or more or less, depending on where you live in the country. But it's always hard to cultivate good relationships. And I think that slide on the bottom there with the guy on the bike, I think that's what we usually do. We're just we actually don't even know what our goal is most of the time. We just know what the direction we're going to, and then we don't know what it's going to be. All those pitfalls and stuff happen all the time. So we need to figure out ways to make it work better, and some of the common problems and solutions, and teamwork is a really big one. Next slide. So again, anyone who, I want to encourage you guys just to raise your hand, and I'll stop because I do want to hear what you guys say, because I think everyone learns in this situation, and that'll be really good. So obstacles. I think we know a lot of the obstacles, and this is what I thought was interesting when I was doing my research for this talk was attitudes. Why veterinarians don't like to work with rescues. I think discount is one of them, and I think some of them is attitude. I think it's hard because people expect a lot. Rescue organizations expect a lot. They don't necessarily always pay a lot, but they expect a lot, and maybe that expectation sometimes is, what do you want to say, is a little too much. One of the biggest things is treat each other respectfully, be nice to one another. I try to understand where people are coming from. My biggest stress in my job is not the 15 cases I see a day. That's the easy part. It's the 15 phone calls I have to do at the end of the day, and the 20 blood works and cytologies and radiograph reports I have to call back. I never feel like I can do a good job. So that's my point of view, is trying to get my job done best as I can and as timely as I can. So the medicine's not a big deal after 20 years. It's more of a time management skill. Also acknowledge the need for one another. We need you, actually. I think without the House Rabbit Society, we wouldn't get nearly as many rabbits as we have, and I love working on rabbits, and so do 2 other vets I have working with me. So without them, we wouldn't be able to support our business and support our technicians and our support staff. So we need you just like they need, you need us. And then the passion. I know sometimes we get really upset or really into something, and that could cause, as I wrote in there, emotional entanglements. It can cause some issues when we get too emotional in there. And we're not all greedy vets, and you guys are not all crazy rescue people. And it's funny though, because, well, maybe some of you are, but not all of you. I do a lot of holistic medicine, so the exotic people who I used to think are crazy are nowhere near crazy compared to those people. Yes?
I had a funny little discussion with one of my favorite pets. I asked him, we were just talking about crazy rabbit people, and I said, so are rabbit people the craziest? He has an exotic rabbit. Are the craziest? He says, no, actually the guinea pig people are crazy.
I think the bird people are way crazy. What's that? I don't know. I don't know why it's so different. I think it's just selection. People who choose to get birds or reptile people, they're pretty interesting too. So we used to make them pay before their exams because they canceled so often. It was horrible. Anyways, so yeah, go ahead, next slide. Oh, you had a question? Sorry.
Well, I'm maybe I'm so how do you manage to work with different vets at the same time? For instance, in our town, we have one Bernie vet. She is very passionate, extremely knowledgeable, works with rescues, and she's also very expensive, right? You get what you pay for. And there is another vet who is also very good, cheaper, and he will do the regular, like as long as you don't have a serious specific disease, I would advise people to go to them. So how do you work with both of those vets without putting them in competition?
Would probably be a good question to ask amongst your, I don't know if you heard the question. The question was basically, she has one veterinarian who's really great, really passionate, wonderful, a little bit more expensive, another veterinarian who's also good, a little cheaper, and she trusts him to do the more standard stuff, not the more, complicated stuff, I suppose. So how do you deal with both of them? And we have that situation here in San Diego, because in San Diego I know there's several veterinarians that we work with, and I think it's really reading the client. I mean, if the client wants the absolute best for the rabbit, and the money maybe isn't as big a concern, then refer to the best. If the client maybe is a little bit, doesn't have maybe the resources as the other client does, or maybe the case isn't as complicated. I mean, it's hard to dole out referrals. It is hard to know what the best one is. And that would be something I would really, I don't know because I don't deal with that. I'm obviously on the other end where I get the referrals, but I don't know how you guys handle that. Does anybody have an answer to that question on how they do it?
I can answer that.
Good.
Yeah, I get that question still all the time. And like Dr. Bausone says, you kind of have to assess the individual that's asking the question and what their abilities are relative to what they can afford to pay and what their expectations are. Sometimes, especially their expectations, because you might just randomly, refer them to somebody, but then you discover if they went to somebody that you think is awesome, but their expectations weren't met, they're not happy. So you kind of have to try to feel them out by having a conversation and getting an idea of that. Plus, I also ask, well, what do you think is wrong with the rabbit? Or maybe they really do know, what's going on. And based on what that is, then I thought, okay, I know, what they might be able to afford, sort of. I don't get that deep into their finances. What the money might be suffering from, what the symptoms are, and then kind of what their expectations are. And then I think about, the 7 or 8 vets I can refer them to, and I'll pick 2 or 3 that I think will meet their expectations and be affordable for them and whatever. But of course, if it's somebody that comes in, and I would tell them too, depending on what the condition is, I'll say, well, for this condition, these guys are great or whatever. But if somebody's got a really specific, difficult case, and I know that a particular vet really handles those kinds of medical cases very, very well, but maybe they are more expensive, I will tell them that these people are great to go to or whatever, but here's this one that is really great with this particular issue, and they are a little bit more expensive, but you're really going to probably reach a good conclusion after. I try not to pit the vets against each other and to try to be fair. So generally I'll give 2 or 3 recommendations to a person.
Yeah,
that's how I can do it.
That's a good answer. In San Diego, at least, I'm sure there's at least 6 or 8 vets that you commonly refer to. So maybe we're lucky, in that area. And I know at our hospital, for instance, one of the things that we get referred to a lot is dental problems, because we do a lot of dental problems, and we do it, I think, pretty decently. So that might be something like Judith was referring to. Okay, back on track real quick. Obstacles. What's some time? We're all busy. Rescuers mainly volunteer, and their time is important. Veterinarians, of course, are busy as well. Next. Money. Oh boy, that's always the biggest thing. So one of the things I wanted to say too is, what do you guys think the profit margin is on a veterinary hospital? Unfortunately, I know that sounds like a dumb question, but it may bring things to the center. Would anybody have any clue? Like, throw out a number. What do you think on every dollar I make, how much money goes to the profit?
5%. 10.
A well-run veterinary hospital is maybe 20%. A well-run hospital, some up to 25, most are around 15, some 10. So that's the reason why some veterinarians are a little tight with, discounts and so forth. If they're looking for the now, the quick fix, then 10% is probably all you're going to get. If they're looking long-term down the road, then hopefully you get a little bigger discount because they see the referrals and other things as a different, so almost like I hate to say it in terms of business, but a lost leader item if you think about it that way. So yeah, rescues have limited funds, right? I mean, if you guys were all rolling in cash, we wouldn't be having this discussion. And if veterinarians were all rolling in cash, we wouldn't have this discussion either. This is an interesting thing too, and it's way off topic, but veterinarians says veterinarians need to make a respectable living to get paid. One of the biggest things in veterinary medicine right now that we're all talking about is student debt. I graduated 21 years ago. I have some debt, but it wasn't a big deal. A lot of these veterinarians that graduate, I'm not exaggerating, with $200,000 or more in debt. And it's really a big problem, and I don't understand. It makes me very, very sad because I don't know how they can be happy if they can't even put the food on the table.
I'm finding a lot of our younger vets are quitting and going into emergency medicine to try and pay that off.
Yeah, I think a lot of people are trying to do whatever they can. They work full-time jobs and they pick relief too. So it's not a sustainable model, that's for sure. But anyway, so I digress. Next, communications. This is a big one, actually. I think, and the relationships that I've had with other rescues that have failed have almost entirely been because of communication. So this is really, really an important thing, and we talk about this. I don't care if it's with your kids, with your wife, or husband, whatever, and or with rescue organizations. There's a lot of times rescues and veterinarians have a lot of people who are employed, but we need to try to limit who are the go-to people. We used to have at my hospital one go-to person, and then when she quit, that caused a little bit of a ruffle, and then when the liaison for medical needs from the House Rabbit Society left, that caused another issue. We had some bumps along the road, but we had some face-to-face meetings that finally put things back in line, thank goodness. But yeah, you do have to limit the amount of go-to people. So if you have a volunteer who comes in, I don't really want to talk to that volunteer because I'm going to have to talk to that person, and then I'm going to have to get approval from the next person. So with limited times, we have to somehow streamline our communication techniques. What we do all the time at our hospital, and I'm not saying it's right, I'm just telling you what we do, is for house rabbits, we do drop-offs. So except for one client, one person who, I think in San Diego, we probably know who that is, but there's one person that we tolerate. It's a nice guy, but anyway, but the rest of them are all drop-offs, 10 minutes. Oh, we gotta quit, okay. So we just do drop-offs, so then we get back to you when we can. We call the person who is the person who controls the purse strings, basically, who allows being able to approve or not. Conflict resolution. I wish everything went well, but animals sometimes, on a routine spay, I haven't had one in a long time, but knock on wood, that an animal has died, but it will happen. And so we need to be able to work out our cases well and keep it very civil. The little slide over there about someone getting kicked over a conflict, that's not really the way we want to try to see each other's point of view and come to a reasonable solution. Keep things in-house. Don't go bad-mouthing a veterinarian's name. It's like hopefully we're not going to go bad-mouthing someone else's name. I see a lot of referral cases because of holistic medicine and because of exotic animal medicine, and I'll tell you, and I do, of course, regular dog and cat medicine too, and there's a lot of times I just have to turn an eye and go, oh my God, that was done so badly, they shouldn't have done that, but I never say anything. And I mean other veterinarians, I don't mean the House Rabbit Society, but you can't go out saying bad things to people, so keep it public and don't go spreading rumors, and hopefully it doesn't happen. Anyways, next. Partnerships, setting expectations, payments, fee schedules, all that kind of stuff. This is kind of the nuts and bolts of the whole thing. Setting expectations is huge. So just next slide, please. Expectations. This is really important because you may be expecting that a doctor can drop everything he can do or she, and be able to address the needs of everything. That might not always happen. So I know that at our hospital we have a certain amount of space and neuters that we say is okay for a week. You know, you can bring in 3 of these or 2 of those or whatever. And of course, you have to be a little flexible. That's our general rule. Recently, the House Rabbit Society in San Diego had a huge confiscation case, and so that rule went out the window to make room for that. But there are expectations. Get it in writing too. I mean, I think that to sit down with a veterinarian and actually talk about what we can give and what you can give and what the expectations are, I think is really important. Because if all I'm thinking is, oh my God, these guys are going to take a lot of time, and all I'm going to get, I'm going to give them a 10% discount because it's going to be a pain in my butt. But I'm not looking at the referrals, and I'm not looking at the down the stream things. Maybe I'm not as willing to give discounts because I'm not thinking about that stuff, and maybe you need to educate us on that kind of stuff. Procedures, how are we going to do this? Are we going to do in-room appointments? A lot of veterinarians don't want to do in-room appointments because that's their source of income. So they want to do drop-offs and then work things in. Who has the power to approve treatments? We want to talk to those people. And then you guys need to get records. So we should provide you with records of what we did. I think that's one of the mandates on the House Rabbit Society website anyways. Next. Best ways to communicate. Let's set that up too as expectations. I mean, emails, texts, cell phones. How are we going to do this? What's the best way to communicate? I think this is a big one. This next one, honesty about prognosis and cost. We can do a lot, you know, in veterinary medicine now. I mean, so much we can do, but it costs a lot of money. So I think it's incumbent upon us as veterinarians to say, I can do this, but I'm not sure the prognosis is that great. And it's incumbent upon you to say, I'm not sure I want to do that, or I'm going to do that anyways. We need to be honest. We have to be able to communicate with one another and say those different things. I mean, we have to make those tough decisions. If we didn't have to pay for it, we didn't really care, but we do, obviously. And be consistent. Don't change the rules without discussion. So if all of a sudden we increased our prices or decreased our discounts, we need to talk about it. So we just have to, I mean, communication. It's really simple. Next, payments. We just need to talk about what are we going to do. You got to be honest about it. You know, I think most veterinarians expect to get paid about once a month. I think would be a decent thing. Sometimes I've seen twice a month. In special cases, like I said, be consistent with discounts, but in special cases, sometimes we give bigger discounts because we really want to help that animal who has a liver torsion, so it's going to cost $3,000 to fix in the hospitalization. So maybe we discount more, or maybe you guys have to do fundraisers to help with those cases. I think in general, you know, veterinarians really want to help, I hope, and try to do our best. Yeah, I wish my schedule looked like that, you know, that timetable there. But we need to veterinarians need to put time for rescues. If we don't put time for rescues, it'll never get done. We also have to be flexible in that we expect to be able to get to this case, but if something else comes in, you guys have to understand that, you know, I just had an emergency float surgery come in and I have to put off the neuter. Hopefully that's okay. But we also have to be flexible too. For an emergency case that comes in, we need to put off a standard one to be able to take care of that too. Okay, next one. Again, communication. Kind of boring, but it's all what it's all about. We need to be able to talk about this kind of stuff. We need to support each other. We need to involve veterinarians. Hopefully we'll go to some of your events and maybe even sponsor some of your things that you have going on, whether it's, you know, a buddy day or whatever else. Hopefully they'll be able to do that, help you with low-cost spays and neuters, and hopefully you can refer to them as well. Like I said, limit the amount of people to talk to, because if it's too many people, it's going to be the whole telephone game, and it's never going to get there. And if there is a conflict, please sit down and try to resolve it. Let's not throw the baby out with the bathwater thing, because sometimes we get so emotional it gets to be a mess. Okay, next slide. I think this is the last one, guys. So basically, let's try to make these things work. I mean, it's so important. Like I said, I can't even tell you what I've learned. I've said it already from the House Rabbit Society. Hopefully they've learned some stuff from me. But more importantly, I've had a lot of fun, and it's really made a big difference in my career and in my life. And I've gained a lot from them, and I hope a lot of people will feel the same. We've had a lot of fun together. And, you know, in the end, it's all about the animals. You know, it's not really all about the money. It's all about the animals. And let's try not to get in each other's way and just do what we can do. So I think that's all I have.